Hello, I am Bruce Buchanan. I'm a retired periodontist, was in private practice for 25 years, and I was also taking Flomax. And Flomax is a medication, as you can see on the commercials on TV, to, if you are considering eye surgery, tell your doctor that you are taking Flomax. Well, I was taking Flomax, and what this causes is yet another problem for the surgeon. It has a syndrome called Floppy Iris Syndrome. Well, Dr. Gulani, the one thing I was wondering, when a patient is taking Flomax, we all see the commercials on TV that if you're taking Flomax, advise your eye doctor that you are doing this. But they don't really say why you're supposed to tell the doctor. But I did learn that it is because it creates a problem for the surgeon while he's doing the surgery. Could you explain that to me a little bit, please?
Absolutely, Bruce. What Flomax does is, for the eye surgeon, when he's doing your cataract surgery, it is very important for us to dilate your pupil prior to cataract surgery so you can see the whole cataract and then remove that cataract completely. With Flomax, the pupil tends to not dilate so well, and also tends to kind of literally blow up and down, if you may, like a trampoline. That causes a tremendous difficulty, because if the pupil is small and you cannot see the full cataract, you're actually operating without good visualization. That makes the surgery a little more risky for the patient too. Second, you have to control the iris movement, because otherwise if you lose too much pigment of the iris, you'll always have visual aberrations in the eye. So all in all, not having a well-dilated pupil that stays dilated during cataract surgery makes it very, very difficult for a cataract surgeon to do his job well. So that's why it's important to let the surgeon know, because there are ways to work around it. One is we could use special medications prior to your cataract surgery and give you enough time to dilate to the maximum you can. Then in surgery, there are various things that can be innovatively used. We can use removable hooks to literally go in and kind of tent your iris and dilate it for surgery, and then remove the hooks and your iris is back to its normal. Second, something new out there is a ring which when we put it into the eye, the ring can actually expand the iris and keep it large while the cataract surgery is being done. And again, the ring can be removed so the iris comes back to its normal size. And therewith, a floppy iris patient can still have an excellent outcome. So when the surgeon is prepared, it is more easier because he can have all these things at his disposal during surgery and making it a planned surgery again. So all in all, when the doctor is more knowledgeable about what you have, he expects a level of difficulty and is more prepared, then the outcomes are obviously much more consistently excellent.
Good, thank you. Okay, another question. If you are taking Flomax and you do have the situation of the floppy iris syndrome, can you expect the surgery to be successful to the point where I will no longer need glasses for anything except maybe close-up reading?
Sure. Just like in your case, Bruce, where you don't need glasses for distance or for near reading, the concept here is, even if the surgical technique is difficult, the concept of wanting to make you see without glasses should not change. And we've had a lot of discussions even prior to surgery, and you know that's the way I function. I like Q&A, and the drive I carry is, no matter how complex a situation, you do not shortchange the endpoint. So yes, even if the surgery is difficult, it is important to still aim for surgery or vision without glasses. Now, let's say in your case you had astigmatism along with your floppy iris syndrome.
Which I did.
And you had a refractive error for which you wear glasses for distance.
Which I did.
So by selecting a toric lens, meaning a lens that corrects astigmatism, as well as having that lens to be of a certain power so it cancels off your glasses, we were able to come straight to the zero line, which is you don't need glasses for anything. Your surgery was more difficult than a normal cataract, but we expected it and we were ready for it. So again, the point over here is, a complex case does not necessarily mean you shortchange the endpoint. You still want every eye surgeon to have the drive to take you to vision beyond glasses.
All right, thank you. Yes. All right, so I had another question. First, a comment for you guys out there. you always need to tell your eye surgeon that you are taking this medication. And do your research about it and find out, actually you can find out how much your doctor knows about the whole situation. If he doesn't know as much as Dr. Gulani, say thank you very much and walk out the door. But I have another question. Let's pretend that I had eye surgery somewhere else. And I had cataracts, and I had cataracts removed, and I had lens inserted, but not the high-end lenses. Mm-hmm. And so, because I didn't have the high-end lenses, I still need glasses to function for reading, for distance, whatever. Is it possible, once you've had cataract surgery with lens implantation, is it possible to replace those lenses with high-end surgery, high-end lenses, excuse me, so you can get to the point where glasses are no longer needed?
Yes. The answer to your question is at two levels, Bruce. Actually, it does not even matter if you were a Flomax patient at that point. Anybody who's had cataract surgery before and successfully had the surgery but ended up with glasses for whatever reason, if the lens power wasn't accurate or whether they had residual astigmatism, nearsightedness or farsightedness, yes, you can go in and exchange the lens for a higher generation lens, whether that's Toric, meaning astigmatism correction, or whether it's also for that helping you to see distance and up close, the progressive multifocal lenses like Restore, Crystal Lens, other ones. So answer is yes. Now, the other thing you can do with such patients is, instead of exchanging their lens, since they already had cataract surgery, is you can safely go outside on the eye and do a LASIK. So instead of going back into their eye, which is a little more risky, and removing their lens, which is a little more traumatic, you can actually go on their cornea and do a LASIK procedure on top of their cataract surgery.
This is just to shape the cornea?
Exactly, that's what LASIK is all the time. Mm-hmm. So you can shape the cornea to correct the astigmatism, nearsightedness or farsightedness and have the people seeing without glasses. So, and on that note, it doesn't even matter if you're a Flomax patient, because if you had cataract successfully, you can now do LASIK on top and correct you, and again you're without glasses.
Great.
So yes.
Okay, thank you.